Survival knowledge, the forgotten science of staying alive. Civilization gave us pills. The earth gave us everything else. When the pills are gone, you return to the earth, or you don't return at all. The night grows colder. Your fire crackles softly against the dark. This is no longer fear, it's training. Every flicker of the flame, every breath of wind is a reminder. Survival is a system, and infection is the test that decides whether you understand it. You spread out your notes on the ground, hand-drawn diagrams, lists of herbs, sketches of wounds. Each page represents rediscovered knowledge, lessons once taught to healers, hunters, and warriors thousands of years ago. Now, they are your textbooks. To understanding wounds and risk. Before you can heal, you must recognize a wound is not just a tear in the skin, it's an open gate. And in a world without antibiotics, that gate leads straight to infection, your most silent predator. There are 5 basic types of wounds you'll face in the wild. Abrasion, skin scraped off by friction, usually shallow but prone to dirt contamination. Incision, clean cut from a sharp edge, knife, stone, glass. Easier to treat if cleaned fast. Laceration, torn, jagged tissue from blunt trauma. Irregular edges trap bacteria. Puncture, deep, narrow wound from thorn, nail, or tooth. Dangerous because infection grows inside, unseen. Crush or compound wound, tissue destruction, often with broken bone. Near impossible to treat without advanced care. Every wound carries 3 risks: contamination, bacteria, dirt, or decay entering the tissue. Inflammation, the immune system's war response. Sepsis, when that war spreads throughout your blood. You must treat a wound as fast as possible, before the bacteria multiply, before fever sets in, before your body turns against itself. Rule 1. You don't need medicine to survive an infection. You need speed, precision, and calm. 2. Field sterilization. When the world had hospitals, sterilization was invisible. Autoclaves, alcohol wipes, UV lamps. Now, you must recreate it with what's left around you. Boiling. Boiling water remains the oldest and most reliable method. Heat kills most pathogens at 100 degrees C, 212 degrees C. Boil for at least 10 minutes. If you're in high altitude, add a few more. Use this water to clean wounds, soak tools, or rinse cloth bandages. Fire sterilization. If you have metal tools, knives, needles, tweezers, pass them directly through a clean flame until they glow faintly red. Let them cool naturally. Do not blow on them. Breath carries bacteria. Sunlight, UV. If you lack fire or fuel, spread cloths or bandages under direct sunlight for 2 to 4 hours. UV radiation from sunlight is a natural sterilizer. Ancient tribes used it long before laboratories confirmed it. Salt and vinegar. Salt water, strong brine, or natural vinegar from fermented fruit, both inhibit bacterial growth. You can create a makeshift sterilizer by boiling water with a handful of salt or mixing vinegar 1.1 with clean water. Soak cloth or wash surfaces with it. Smoke and resin. If in a forested area, burn pine, cedar, or juniper wood. Their smoke contains phenols, natural antiseptic compounds. Healers once used smoke to purify wounds and drive off insects. Rule 2. Sterility isn't about perfection. It is about removing what kills you faster than your body can repair itself. ABOS Natural Antiseptics by Biome. Nature hides its medicine in plain sight. Every ecosystem, forest, desert, mountain, tropic, has its healers if you know where to look. Forest and woodland pine resin, sealant and antiseptic. Warm it slightly. Apply over cleaned wound. Oak bark, rich in tannins. Boil into a brown tea and use to rinse wounds or gargle for mouth infections. Plantain leaf, Plantago major, crush into a paste. Soothes inflammation, draws out infection. Tropical jungle coconut oil, antibacterial, antifungal, and helps keep wounds moist without decay. Turmeric root, natural antibiotic, apply as paste or drink as infusion for internal infection. Papaya leaves, enzymes help clean dead tissue from infected wounds. Desert aloe vera gel, cooling, antibacterial, promotes healing of burns and cuts. Creosote bush, desert plant with strong antimicrobial oils. Boil small amounts to make cleansing wash. Salt crusts, natural deposits near dry lakes, dissolve in water for wound rinse. Mountain, Arctic moss, sphagnum, naturally sterile, once used as bandage in World War I. Yarrow stops bleeding, reduces infection. Chew into paste or apply as poultice. Spruce resin, similar to pine, antibacterial and sealing. Rule 3. The medicine of the earth is not found in pharmacies. It is found in patterns. Where there is decay, nature grows something to fight it. 4. Improvised tools and techniques. You don't need steel to perform first aid. You need ingenuity. For cleaning, use boiled cloth, moss, or bark fibers as sterile pads. Pour sterilized water gently. Never scrub raw tissue. For bandaging, cut strips of clean fabric or animal hide. Wrap snugly but not tight. Allow air circulation to prevent anaerobic infection. For closing wounds, small cuts. Let them close naturally after cleaning. Larger wounds, use butterfly leaves. Fold and tie from thin plant fibers, vines, sinew. Emergency. Heat a metal needle and sew with sterile thread, fiber cord, or clean hair. Only if the wound is clean. For drainage. If a wound swells, reddens, and throbs, you must let it drain. Use a sterile thorn or heated knife to open the abscess slightly. Press gently to remove pus, rinse with boiled water and salt. Painful, but life-saving. Rule 4. Pain is information. Don't silence it. Interpret it. Recognizing infection and escalation. Infection is not instant. It's a war that unfolds in stages. Recognizing them can save your life. Stage 1. Contamination, 0-6 hours. Dirt enters wound, no symptoms yet. Clean immediately. Stage 2. Localized infection, 1-2 days. Redness, warmth, swelling, mild pain. Action. Clean again. Apply antiseptic, change bandages often. Stage 3. Abscess formation, 2 to 5 days. Throbbing pain, pus, bad odor, increased swelling. Action. Open, drain, disinfect. Keep covered but ventilated. Stage 4. Spreading infection, sepsis threat. Fever, chills, weakness, rapid heartbeat, red streaks moving up limb. Action. Rest, hydrate, apply hot compresses. Treat systemically with herbal antimicrobials. Stage 5. Sepsis, systemic infection. Confusion, low blood pressure, cold sweat, blue lips. Critical. Only survival chance. Fluids, warmth, and prayer. If untreated, death in hours. Rule 5. Infection whispers before it screams. If you listen early, you live. 6. Field treatments and natural remedies. When infection has begun but hasn't spread too far, your best weapons come from the earth itself. Herbal antimicrobials, garlic, allicin. Crush raw and apply or swallow small pieces. Honey, raw, unprocessed, ancient antiseptic. Seals wounds, draws moisture out of bacteria. Thyme or oregano oil, potent antibacterial. Mix drops with clean oil before applying. Ginger, anti-inflammatory, use as tea or compress. Echinacea boosts immune response, reduces swelling. Wound packs, poultices. Mix antiseptic herbs, plantain, yarrow, turmeric, with clay or clean ash. Spread over wound, cover loosely. Change twice daily. Hydration therapy, fever and infection, dehydrate fast. Boil water, add pinch of salt and small amount of sugar. Makeshift oral rehydration solution. Steam inhalation, respiratory infection. Boil pine needles, eucalyptus leaves, or mint. Inhale vapor carefully under cloth. Clears airways, disinfects sinuses. Burn treatment. Cool with clean water, not ice. Apply aloe or honey layer. Never burst blisters. They are natural bandages. Rule 6. Every wound is both physical and chemical. You don't just fight bacteria, you fight imbalance. Only supporting the body. Hydration, nutrition, immunity. You can disinfect a wound perfectly and still die if your body can't fight back. Survival medicine isn't about fighting infection externally. It's about reinforcing your internal fortress. Hydration. The body is 60% water. Lose just 10% and your immune system fails. Drink boiled water frequently. If you sweat or vomit, replace salts with a mix of 1 liter water plus 1 teaspoon salt plus 2 teaspoons sugar. Nutrition: protein repairs tissue. Fats provide long-term energy. Carbohydrates fuel recovery. In survival conditions, insects, fish, seeds, wild greens all rebuild your defenses. Immunity boosters: vitamin C from berries, citrus, or pine needle tea. Zinc from nuts, shellfish, or roasted insects. Sunlight for vitamin D. Step outside daily. Sleep and calm. Stress kills immunity. Every night, slow your breathing. Let your heart rate fall. Healing happens in rest, not panic. Rule 7. The most powerful medicine isn't ET in a leaf or a bottle. It's in your blood, your calm, and your will to live. Survival knowledge. You stare into the fire again. The air feels different, lighter, purposeful. The fear that once paralyzed you now turns into focus. You're not helpless anymore. You're learning to replace dependency with understanding. The world may have forgotten the science of survival, but you haven't, and that makes you dangerous to extinction.